Welcome to aminacademy.com. In human anatomy and physiology, let us discuss about restrictive lung disorder. Restrictive lung disorders are characterized by increasing stiffness, that is, low compliance of lung tissues, making it harder to inflate the lung and increasing the work of breathing. Chronic restrictive disease is often associated with progressive fibrosis caused by repeated and ongoing inflammation of the lungs. Pneumoconiosis. This group of lung disease is caused by a prolonged exposure to inhaled organic dust, triggers generalized inflammation and progressive fibrosis of lung tissues. Inhalation of workers-related pollutants was a major cause of lung disease prior to the introduction of legislation that limits workers' exposure to them. Poll workers' pneumoconiosis. Inhalation of coal dust over a prolonged period leads to varying degrees of respiratory impairments. Many minors develop little or no disease, but others suffer massive progressive fibrosis that is ultimately fatal. The inhaled dust collects in the lung and is phagocytosed by macrophages, which collect around airways and trigger varying degrees of fibrosis. Silicosis. This may be caused by the long-term exposure to dust containing silicon compounds. High-risk industries include quarrying, mining of minerals, stone masonry, sandblasting, glassmaking, and pottery productions. Inhaled silica particles accumulates in the alveoli and are ingested by macrophages, to which silica is toxic. The inflammatory reactions triggered when the macrophages die causes significant fibrosis. Silicosis appears to predispose to the development of tuberculosis, which rapidly progresses to tubular bronchopneumonia and possibly miliary TB. Asbestosis. Asbestosis caused by inhaling asbestos fibers usually develops after 10 to 20 years exposure, but sometimes after only 2 years. Asbestos miners and workers involved in making and using some products containing asbestos are at risk. There are different types of asbestos, but blue asbestos is associated with most serious disease. In spite of their large size, asbestos particles penetrate to the level of respiratory bronchioles and alveoli. Macrophages accumulate in the alveoli and ingest shorter fibers. The larger fibers from asbestos bodies consisting of fibers surrounded by macrophages, proteins material, and iron deposits. Their presence in sputum indicates exposure to asbestos but not necessarily asbestosis. Extrinsic allergic alveolus. This group of conditions is caused by inhaling organic dust including some minerals. The contaminators act as antigens, causing a type of third hypersensitivity reactions in the wall of the alveoli. Pulmonary toxins. Lung disease can be triggered by a range of toxins and drugs including paraquat. This weed killer causes a pulmonary edema, irreversible pulmonary fibrosis, and renal damage, and ingestion can be fatal. Drug. The mechanism and severity of drug-induced pulmonary damage varies depending on the drug and the general condition of the patient. Some drugs used to treat cancer, including bleomycin and methotrexate, can trigger progressive fibrosis changes. High concentration oxygen therapy. Premature babies many may require oxygen treatment while their functions matures, but the high concentrations used can cause permanent fibrotic damage to the lungs as well as to the retina of the eye. People of any age who require high concentration oxygen therapy may also develop pulmonary fibrosis. Now we'll discuss little about restrictive lung disorders. Restrictive lung disorders are conditions that prevent the lungs from fully expanding, leading to reduced lung volume and impaired lung functions. These disorders can be intrinsic, affecting the lung tissues itself, or pulmonary fibrosis, or extrinsic, due to tissues with the chest wall or muscles. Neuromuscular disorder, obesity, can be intrinsic, affecting the lung tissues itself. Pulmonary fibrosis or extrinsic due to issues with the chest wall or muscles. Neuromuscular disorder, that is obesity, often causing symptoms like shortness of breath, chronic cough, and fatigue. Diagnosis involves pulmonary functions test and imaging, while treatment aims to manage symptoms and addresses the underlying cause, which can range from medications to oxygen therapy or, in a severe cases, a lung transplant. Causes and types. Restrictive lung disorders are categorized based on their origin. Intrinsic parenchymal disorders. This directly affects the lung tissues, causing scarring or inflammation. Interstitial lung disease, ILDs, conditions like pulmonary fibrosis, sarcoidosis, and asbestosis involve inflammation and scarring of the lungs, interstitial tissues, reducing their elasticity. Pneumoconiosis, also known as dusty lungs. These are caused by inhaling specific irritants such as asbestos fibers. Extrinsic extrapulmonary disorders. These affect the mechanics of breathing and lung expansions rather than the lung tissue itself. Neuromuscular disorders. Disease like amyotrophic lateral sclerosis, that is ALS, MS, or polio weaken the muscles responsible for breathing. Chest wall deformities. Conditions such as severe scoliosis or kyphosis can restrict the chest wall's ability to expand. Obesity, excess abdominal fat can compress the chest and diaphragm, limiting lung expansion. Pleural disease, inflammation or thickening of the pleura, the lining around the lungs, can hinder expansion. Symptoms. Common symptoms of restrictive lung disorders include shortness of breath, dyspnea, especially with exertion, a persistent dry cough, fatigue and easy fatigability, chest pain in some cases. Diagnosis. Diagnosis typically involves a combination of methods. Pulmonary function test, PFT. These measure lung volumes, revealing a reduced lung volume, decreased forced vital capacity of FVC, and an increased FE1 or FVC ratio as air movement is preserved. Imaging test, chest X-ray and CT scans can show lung tissues changes or chest wall abnormalities. Bronchoscopy, A flexible tube with a camera is inserted to visualize airways and obtain tissue samples. Pulse oximetry measures blood oxygen levels to assess gas exchange. Some treatment strategies vary depending on the underlying cause and severity. Medications corticosteroids and antifibrotic agents may be used to reduce inflammation and slow disease progression in some intrinsic disorders. Oxygen therapy may be used to improve blood oxygen levels. Supportive therapies, expectorants, bronchodilators, and management of other sleep disorders can help manage symptoms. Lung transplantation. In severe cases where others treatment are ineffective, a lung transplant may be an option. Lung transplantation is a surgical procedure that replaces diseased lungs with a healthy lung from a diseased or rarely living donor to improve a patient's quality of life and extend their survival from end-stage lung diseases. The procedures involves organ harvesting, preservation, and implantations with the main goal of restoring normal pulmonary physiology and gas exchange. Post-operative care focuses on preventing complications like primary graft dysfunctions, PGD, infections, and rejection, which are significant risk in the recovery period. So far, we discussed about restrictive lung disorders. We have done. Please subscribe our YouTube channel.